a lot of the symptoms that we have that you're both talking about have a lot to do with the position of the uterus, honestly. And there's all these different ways you can see in that second diagram. Particularly, there's like several ways the uterus can become misaligned. And this happens for a variety of reasons. Some of it's just as a product of like falling on your pelvis. Sometimes it's how the uterus shrinks back down after birth. If there's no like abdominal massage or vaginal steaming practice in place to help the body come back into alignment neutrally, it can happen if you're in any kind of, speaking of the way we hold tension, speaking of tension, if you're in any kind of like traumatic or emotionally stressing scenario, whether it's sexual or not, your body holds on to tension in different ways. Sometimes it's left and the right side of the pelvis hold differently. And so it just kind of creates a chronic situation over time. So this dynamic, or this diagram, shows how the uterus gets out of alignment in an anterior versus posterior position, but there's also left to right. And so I don't tell you this to freak you out and to set you on a trajectory of trying to figure out if your uterus is out of line, although you may have heard that from a gynecologist, and I did several times in pap smears and whatnot, because it is very common, but it's not a normal, natural way for your uterus to fit inside of your pelvis. And when it is in a misaligned position, it can, like in some of these diagrams, you can see it presses against the uterus, or it presses against the bladder, which can cause an aggravation of, all kinds of situations, urge incontinence to stress incontinence, which are two different ways in which women leak. One of them has to do with there being a little too much tone in the pelvis, and therefore the pelvic floor musculature is weak and it's difficult for the sphincters to operate correctly. And one of them is because the pelvic floor musculature is too loose, and also there's a disconnect with the neural pathways and the firing of those sphincters. So I bring up uterine position. Pretend I'm a uterus. All right, here I am. Cervix is down there. These are my fallopian tubes, right? If I am tilted like this, for example, this fallopian tube is hanging out in space, not connecting with an ovary. It's misaligned. Okay, so that can affect all kinds of things, including our fertility, but most importantly, what I want to mention here is how that ovary is responding to that pressure and that tension of being kind of squished and potentially not ovulating on that side. So when we're not ovulating, typically we ovulate left, right, back and forth. But when our uterus is tilted or squished over, or the ovaries are being misaligned and we're not ovulating on one side, that's half of the time that we're not getting progesterone and we're not getting our hormone cycle regulated by the natural expression of how the reproductive system should work with a normal and healthy aligned uterus. So that affects everything from postpartum depression to how we're experiencing our hormones and moods in perimenopause and menopause. So paying attention to uterine alignment, actually scratch that. You don't have to know where your uterus is. You can get to know by learning to sense and feel. You can actually do abdominal massage and get sensitive enough to be able to feel where it is. I've done the very first level of a technique of abdominal massage that teaches practitioners how to feel where the uterus is. I'm not at the point where I can diagnose where a woman's uterus is from the outside, but I can help her figure that out from a self-massage technique internally. You can tell a lot about where your uterus is by where your cervix is. So if you look at that diagram again, on the top one, it has a little arrow to where the cervix points. So when you have an anteversion, like your uterus is tilted too far forward and it's squishing the bladder, your cervix is poking your rectum behind. So when you or if a gynecologist were to insert fingers in to give you an exam, they would have a hard time feeling it. And so you can kind of tell by where your cervix is inside of your vaginal canal where your uterus is hanging out. And that's one practice that I highly recommend all women do on a regular basis. So understanding where your uterus is, we've covered that. That's a really good reason to do an internal, I call it vaginal mapping. So understanding where your uterus is by understanding where your cervix is. And so therefore you can do prescriptive self-massage techniques on the inside and on the outside through your belly and like into the pubic bone area. And I can show you guys a little bit more of that if you want. And then you can also do a fair amount of de-armoring, it's also called, by gently exploring the interior of your pelvis. And I have made a little like sort of a step-by-step ebook on how to do internal vaginal mapping, which I'll be happy to link to you guys. But the key thing is to take it really, really slowly and to not rush in a way that would cause you to further desensitize yourself. The whole point is to get more sensitive and to reconnect and to be nourishing and take care of your tissues. So you just want to be, it's like taking a psychedelic journey. You want to have set and setting. You want to be mindful of what's going on around you and what your internal state is.